Hey guys, I'm Dr. Ghalili. We're here with Justin. Justin has been facing some cold symptoms with the sniffles that have been running around, plaguing offices all around town. Everyone's got the sniffles now, flu, cold. Justin, you kind of want to tell people what you've been dealing with and for how long?
Right, so for about the past month, I've been coughing a lot. I've had some sinus headaches. I've had a stuffed up nose. I've had some nausea. So I know something's just plaguing my system. And I'm also a type 1 diabetic. So that's an autoimmune disorder. So my immune system's already not the best. So this flu season really hit me hard.
All right. So what we're doing for Justin today, we're giving him our Immune Boost IV in half a liter of saline. This is packed with B vitamins, zinc, selenium, trace minerals, and we've added glutathione to the mix. And the glutathione is a master antioxidant in the body. What it does is fight off free radicals, which basically means in layman's terms, it improves your immunity, boosts your immune system, and Justin can definitely use that for the symptoms that he's having at this time.
Definitely. And one thing that I have been doing every day, which a lot of people do during the flu season, is I use emergency or airborne, and apparently doesn't work very well.
So I'm not a fan of emergency or airborne. They use a low quality vitamin C. It's not liposomal. It won't really increase your blood levels like a liposomal or an IV would. So when you get IV vitamin C, which this strip has about 10 grams of IV vitamin C in there to really help boost the immune system. That way it's building up in the bloodstream. You have a steady level within the bloodstream. Even though it's short acting, it still gets a high enough level to go in and hopefully reduce any sort of infection, whether viral or bacterial. The airborne also has synthetic vitamins such as cyanocobalamin, which is a synthetic form of vitamin B12 that unfortunately many people with different genetic variabilities will not be able to absorb properly. You want to make sure your B12 is methylcobalamin in your supplements. You don't want the cheap synthetic vitamin B12s that you're getting in kind of all these over-the-counter things like airborne, emergency, and there's a few others.
Why is now a good time to get the IV?
So once a patient starts developing symptoms, as you know, most of these infections are viral. So you start with a runny nose, you get the clear fluid, the mucus, you get postnasal drip when you lie down in bed at night, and then you start developing the cough. We see this time and time again. By hitting the immune system early, getting the right vitamins, minerals, nutrients, B vitamins, glutathione, your high-dose vitamin C, you can help combat the infection earlier on to prevent it from worsening to a point where then your doctor is going to prescribe you antibiotics you don't really need it when it's a viral infection that's just been going on too long. You want to prevent that mucus buildup from the viral infection that can potentially lead to a bacterial infection. If there's too much buildup and you're not getting the drainage, especially out of the nose and your sinuses, bacteria can also build up afterwards. Then that's when in about a week or two when patients have these symptoms, you start seeing that, my mucus was clear, but now it's been green for the last couple of days, but it was clear for 2 weeks. Or it's turning green, brown, you start developing a fever, you start getting the tenderness over the areas, which could potentially be indicative of a bacterial infection. So we want to prevent that. We want to prevent our patient from, having to take antibiotics unless it's absolutely necessary.
How often can you do the IV treatments?
That's a great question. It depends on the severity of the condition. I'd recommend anywhere, usually in a case like this, 1 or 2 times a week. But if patients are having severe symptoms, they can come in on a more regular basis.
Cool. Great. Any last words? Any last questions? Nope. And how long does this last?
The IV is going to take about 30 to 40 minutes to fully drip. The patient should feel an increase in boost of energy. The patient's going to be very well hydrated for a few days. The effects can last, from what I've seen, they peak in about a day, and they can last for a couple days. But overall, what you're doing is giving your body the right nutrients and minerals for the immune system that you might be lacking in your normal diet. Eating out, eating fast food, whatever the case may be, you might not be getting all these nutrients in on a regular basis. So it's always good to replenish the body, at least on a monthly basis with this.
All right, those are all the questions. All right, thank you everyone for tuning in, and we'll check back in soon with Justin.